Thank you, Madam Deputy Speaker. And I want to congratulate my right honourable friend, the member for Newcastle upon Tyne East, and the member for Harlow for securing today's debate. Young people have faced a great deal of uncertainty and disruption to their daily lives, education and support networks, with many facing financial insecurity, trauma and bereavement. A recent survey by Young Minds of young people aged 13 to 25 found that 2/3 of them believed the pandemic would have a negative long-term impact on their mental health. And in 2017, 1 in 9 children and young people were estimated to have a diagnosable mental health condition. And NHS Digital recently suggested that from September, 1 in 6 young people now has a probable mental health disorder. Access to free, timely counselling interventions for young people can play a critical role in responding to pre-existing mental health needs and those brought about by the pandemic, or even other traumatic experiences. However, government complacency has left CAMHS services overwhelmed and many schools without the necessary resources. Before the pandemic, 1/3 of schools did not provide any in-school mental health support, and recent research by IPPR suggests that as few as 48% of schools were providing on-site access to a counsellor. However, I recently visited Downside Primary School in my constituency of Luton South as part of UK Parliament last week, and the head teacher there told me about the excellent work they are doing to support children's mental health needs. However, they've had to resort to using their own school grant funding to hire in appropriate mental wellbeing support, whether it's a counsellor or a psychologist, to work with their pupils directly in school. And this is because of three overarching barriers restricting children and young people's access to mental health support. Firstly, children and adolescent mental health services just simply lack the capacity to meet demand at the level it is needed, which is often much before a child is in crisis, and also in a timely manner. Too much bureaucracy and form filling, restricting school staff's ability to get mental health support for children quickly, whether that is in relation to diagnosis of a longer term condition, but particularly at an early stage before a child reaches crisis. And CAMHS services are not always reaching or meeting the needs of an ethnically diverse and multi-faith community due to social stigma about going outside of home or school for support, and particularly mental health support. So expanding mental health support to reduce stigma and expanding it into schools is a priority for parents, as they would be much more comfortable and financially able to support their children accessing support in their school setting. And I'd welcome the Minister's comments on this complex and sensitive issue. Parent-Kind's annual parent survey in 2021 found that 41% of parents want any additional school funding to be spent on child mental health services, making it parents' second biggest priority. And 88% of parents wanted mental health development to be an important focus within the curriculum. Yet the government is only aiming to get mental health support teams to 1/4 of young people by 2023. So will the Minister explain in their closing remarks why there is a lack of urgency on the part of government? We need the government to listen to the approach put forward by the Labour Party, which would expand the mental health workforce, deliver access to trained mental health counsellors in every school, which we've heard works well, and support for young people through open access mental health hubs in every community. Under our proposals, every secondary school will have access to a full-time staff member, and primary schools will have access to specialist staff time shared between different local primary schools. Open access mental health hubs would also help reach marginalised children who would otherwise not access mental health treatment. So I'd like to hear from the Minister on whether they agree that a trained mental health counsellor should be available in every school. Thank you.